Hey community, this is Dr. Hugh, and I want to go over a question that I've been getting recently on this post. You can look at some of the questions, and one of the questions is, I didn't think that there was any blood work that could confirm fibromyalgia, and there's been quite a few posts on this. I want to clear this up. One of the things is, when you look at this, is there one single test that can say that you have fibromyalgia or not? No, but that's not the panel that I'm running. The blood panel that I'm running is roughly 11, 12, 13 vials of blood. This is the fishing net. So bigger the fishing net, the more things you're going to bring in, right? More things you're going to catch. So what I mean by that, this is what we call biomarkers. Why this fishing net is 11, 12 vials of blood is because when you run this kind of work, you pull these in and you're looking at your individual biomarkers that may lead to poor function, poor nerves, poor muscles. So for example, I'll give you an example. Is someone may come to me and we may do blood work and we may see 5 or 6 things on their blood work that isn't optimal. And when you go to the conventional system, they're going to run maybe 1 or 2 vials of blood on you. Guaranteed, they're not running 10 vials of blood on you to check out all these different nuances. When you run this panel and you get these things back, so for example, let's say this person has suboptimal vitamin D. So what I mean by that is the vitamin D range on conventional labs is 30 to 100. If you're at 35, you're fine. They're not going to say anything. But that's not where normal, healthy human beings live. Normal, healthy human beings live at, let's say, 80. Let's say your blood work is at 35. You're, quote, normal, but you still feel horrible. You still are in pain. You still have fibromyalgia. You still have brain fog. You're still sleeping poorly, and you have chronic fatigue. That's just one marker. Now, another marker that I run is what we call RBC magnesium, seeing how much magnesium is in the red blood cells. This is a very specific test. The lab range is 3 to 7. If you're at 4 or 5, you're considered normal. I want to see that greater than 6. There's 2 markers. Third marker, and these are just examples I'm just coming up with my head because this is what I see clinically. Let's say the third marker is that we are going to check something called iron. Right now, there's about 6, 7 markers that you want to look at when it comes to your iron status. There's not one, there's about 5 or 6, and all these different markers intertwine each other. You have subclinical anemia, meaning that your iron really isn't robust. It's at the lower end, but you can't be diagnosed with anemia. But if you don't have enough iron in your body, you don't have enough oxygen delivery to the cells. If you don't have enough oxygen delivery to your muscles, you're going to have what? Fibromyalgia. Now, this is if you have subclinical anemia. Now, in the conventional system, they're not going to tell you about that because in the conventional system, it's either you have a condition or you don't. It's black or white. That's not how the human body works. The human body slowly continues to get worse, and then finally you have a symptom. Another example would be, let's say someone has a high insulin level. Insulin is produced by your pancreas, and that's a hormone, and that is pro-inflammation. It's pro-inflammatory. Lab range is to 25, so the broad range, 2 to 25. Now, I like to see that fasting insulin to be about 5, but let's say it's at 15 or 18. It's not over 25, it's not high, but it's not in the sweet spot. This is another marker that we found as well. Now, what are some other things? Could be another marker is inflammation. I check about 5 different markers for inflammation. Thyroid, fibrinogen, CRP. Say your CRP, which is an inflammatory marker. It's just a gross inflammatory marker. Let's say the lab range is 0 to anything greater than 3 is you're considered high inflammation. But let's say that you're not at 3. Let's say you're at 2.5. That's still not ideal. That's another marker that's out of range. Another thing is we can have someone that has a suboptimal thyroid. Maybe you're chronically fatigued, maybe you're losing your hair even, maybe you have fibromyalgia, and they do their cheap panels, 1 vial blood, and they say that it's normal, but you don't understand why you still feel horrible. Now, when you look at a thyroid panel, it's just one simple marker. The conventional system, they're going to run one marker, TSH. Like a complete thyroid panel is, I'm going to go through this. TSH, it's total T4, it's free T4, it's total T3, free T3, reverse T3, and then there's also antibodies that can be attacking your thyroid as well. Let's say you have suboptimal thyroid function. Now, you can't be diagnosed with a hypothyroid condition, but it's not functioning properly. Now, why wouldn't your thyroid be functioning properly? Maybe because you have some sensitivity to wheat, dairy, soy. Maybe you're not sleeping well. This is when a functional medicine approach is when you look at you as a human being. If you're watching this video, you probably have some fibromyalgia, and you start connecting the dots. You make a custom tailored plan based on your needs, based on your blood work, based on what you need, based on your individual problems, your individual symptoms, your individual weak links when it comes to your physiology in your body. This is why you don't have to live with fibromyalgia. Now, you have to find the cause. You have to find a provider that can guide you. I'm a guide. Let's do step 1. Let's do step 2. Let's do step 3. Once you connect these dots, you can get better. Now, if you're sitting in here, oh, this is not real, look at some of the testimonials below that I've listed. Now, if you're here and you're like, I want an answer, I want to search for an answer, then you should click the link and get the labs. It's really simple. Now, if you're at the point where you've given up hope, this video is not for you. It's not for the people that have just, I have fibromyalgia and I've gone to the conventional systems and I'm going to have it forever. If you're at that spot, one, I'm going to tell you, there's a lot of things that can help you that you probably have no idea, and especially if you're in the conventional system, you've never been exposed to these things, and kind of where you're at. But I can tell you this, people come to me, and I help people all over the world, all over the United States through telemedicine. You don't need to see me in person. There's Zoom calls, there's phone calls. You can get these labs. I use LabCorps all over the United States. There's probably one within 5 or 10 minutes of your individual house right now to get the labs that you need. You don't need to beg for labs. I'm giving these labs to you for cost. What the lab charges me is what you get charged for the lab. So this is an opportunity for people to get well. Maybe there's some hope here. Maybe there's a possibility that I can find the underlying cause. Now, when you get these labs back, then you have to connect all the dots, and you have to make a very specific guided treatment based on your needs, not on someone else's labs. Not saying it's all in your head. Labs are normal. Good luck. Here's some antidepressant medication. Here's some fibromyalgia medication for pain. All right, if you're out there and you're still listening to this, click the link and get the labs. It's that simple. You can get well. Take care. This is Dr. Hugh.